For the first time ever, doctors in Boston successfully transplant a pig kidney into a living person. Massachusetts General Hospital says it transplanted that pig kidney into 62-year-old Richard Slayman, who has end-stage kidney disease. Surgeons say he's recovering well and will be discharged soon. Pig kidneys have been transplanted into brain-dead donors, and pig hearts have been transplanted into two people who died within months. This marks a first. Doctors say they have Slayman's bravery to thank.
The success of this pioneering surgery, once deemed unimaginable, would not have been possible without his courage and his willingness to embark on a journey into uncharted medical territory.
More than 100,000 people are on the national waiting list for an organ transplant. Most of them need kidneys, but thousands die every year before their turn comes in. March Madness is officially here. The first round of the 2024 NCAA men's and women's basketball tourneys are underway, and some doctors say many men choose this time of year to sit back, watch the games, and recover from a vasectomy. Yeah, it turns out this type of surgery tends to spike this time of year. Mandy Gaither explains what the procedure entails and what those who undergo it should know.
The madness has begun. With the first round now upon us, some men are ready to post up on the couch.
Guys see this opportunity, take a couple days off, and we end up having the consultations just a little more frequently than any other time of year.
Dr. Peter Sembarlis with Northwestern Medicine says a vasectomy should be considered a permanent sterilization.
We create an obstruction by taking a small segment of the vas deferens out so that the ejaculate no longer contains sperm.
Sembarlis says the procedure takes 30 minutes or less. Patients will be under local anesthesia and afterwards will have up to 4 days of soreness and then a relatively rapid recovery.
I'm pretty strict on the first 48 hours. I say don't do anything that makes you grunt.
2 days after the procedure, there may still be some soreness, but Sembarlis says patients can be as active as they can tolerate. As with any procedure, there are some potential risks.
There is a 1% chance of a lingering pain. That's called post-vasectomy pain syndrome, and it's treatable, but certainly you'd much rather your patients end up in that 99% whose pain resolves permanently.
See a doctor if there are signs of infection, including redness, oozing, or a fever. But Sembarlis says a patient's intimacy will not be altered.
The only thing that changes is the reproductive potential. So sensation, ejaculation, orgasm, urination, hormonal function, things like testosterone are completely unchanged.
For Health Minute, I'm Mandy Gaither.
Congress continues to fight against Chinese technology, why the future of TikTok is still up in the air. Next on News 12 at 5:30.